agonist and antagonist is an important topic in pharmacology. Here, drugs, they act by binding to receptors, and these receptors are nothing but your protein. So these drugs which are binding to receptors, they are of two types, agonist and antagonist. Now we are going to begin with agonist drugs. In the picture, the red is your agonist and the blue color is the receptor on the cell. When this agonist combine with the receptor, they form some kind of stimulation, and thus they give a response which is cell mediated. That is how the agonist drugs act. So agonists are drugs that bind to the receptors and they activate the receptors, thus resulting in some kind of response. Now the tendency of these drugs to bind to the receptor, that is called as affinity, and tendency of the drugs to activate the receptor is called as efficacy. Now based on this affinity and efficacy, agonists can be classified into three, that is your full agonist, partial agonist and inverse agonist. What is full agonist? They are highly potent drug with high affinity and efficacy. It means even when you give them in low concentration, they give full potential or full result. Example is morphine. Partial agonists, they do not produce maximal response even when they are given at an excess amount. Example is Besprin. Now the weakest partial agonist is tolazolone. This is about full agonist and partial agonist. There is one more type, that is your inverse agonist. They decrease the activity of receptors to inactive stage. That is the opposite action. Example is flumazenil drugs, which inverse the agonist for GABA receptors. Now in this graph we can see the receptor response to drug concentration. As you can see, full agonists, they give 100% result. Partial agonists, even when their concentration is high, they give only 50 to 60% result. And inverse agonists, they in turn results in decreasing the activity of the receptor. That is all about agonists. Now coming on to antagonists. Antagonists are those drugs which acts opposite to agonist. Sometimes they take place of the agonist in the same site and the action will be reversed. There are reversible and irreversible antagonists. Of reversible antagonists, first is your competitive antagonist, which bind to the receptors at same site as that of the agonist but does not activate the receptors. Example is IL-IRNA protein. Now this is example for competitive antagonism, where the yellow is taking place of the red and they do not form any kind of activity or response. The second type of reversible antagonist is non-competitive antagonist. That is, they bind to the receptors, yes, but in a different site, unlike the competitive antagonist. Example is binding of cyclothiazide with MGLUR1 receptor. So this is the non-competitive type, where they bind to another site. Here you can see the red is binding to a different site other than the normal agonist, yet they are able to stop the action of the receptor. Now coming to the irreversible type of antagonist. Here the antagonists, they do bind to the same side of the receptor or same site as that of the agonist, but they dissociate slowly or not at all, and you can't reverse their action. Example is aspirin. That's all for today. Don't forget to like, comment and subscribe to our channel. Thank you for watching.